Hello friends, welcome back to my channel. And if you're new, my name is Olaoluwa Fajimi. I'm a portfolio GP and training program director based in Coventry. One of the issues my friends tell me about is going through hospital rotations as a GP. My friends tell me how challenging they find hospital rotation. And in response to that, I've decided to make this video highlighting 7 practical steps to help you navigate hospital rotations as a GP with ease. Number 1 is your mindset. Each time I think of your mindset, I think about that saying that goes by, whether you think you can or you think you cannot, you're right. Friends, no one will treat you better than how you treat yourself. Go to that hospital rotation with the right mindset. I read a lot of posts and really I get heartbroken sometimes. I see a lot of GP trainees seeing themselves as service providers. But you know what? If you think you are going to that hospital rotation to be a service provider, you will be a service provider. But if you think you're going to that hospital rotation to be a valuable member of the team who is only there for a short time, then you would be. But one thing I must say, whatever you choose to be rest assured that people will address you as you've decided. You cannot decide to be a service provider who goes to work, does their bit, and go home, and that is it, and be expected to be treated better than that. But if you see yourself as a valuable member of the team, sure, you'll be treated as one as well. The choice is yours. One other thing is that those behaviors you've mentioned that you receive from colleagues in the hospital, where GP trainees are treated a little bit differently. It's been people before you who have gone to the hospital rotation, seeing themselves as service providers, who have created that mindset. Do you want to do something about it? Or do you want to reinforce it? The choice is yours. If you want to do something about it, it only needs a couple of cycles of GP trainees to change the narrative. Number 2 will be planning. Those of you that follow my videos regularly know how frequently I talk about planning. Don't go to that hospital rotation without a plan. Think about what learning opportunities you've got in that hospital rotation. Think about what clinics that hospital rotation has to offer. Think about what services that rotation gives such that you can benefit from. These are the things you should be discussing with your clinical supervisor at your placement planning meeting. Say you're rotating through OBS and gynae, for instance. You should be looking at attending the antenatal clinic, the colposcopy clinic, the smear clinic. You're rotating through T&O, for instance. You should be thinking of attending the fracture clinic, because those are the skill sets that a GP needs. Plan about your annual leave. I remember throughout all my hospital rotations, I did not finish my annual leave in any of them. Don't be like me. Plan your annual leave well in advance. Plan your study leave well in advance. Take your study leave. Think of the things in that rotation that are relevant to primary care, that you can attend conferences about, that you can attend teachings about. Think about that. Plan around your e-portfolio. Plan for your examinations. While I do not advise you to take your AKT whilst in hospital rotation, but you surely can plan about it. Number 3 step is your identity. Know who you are. You are a GP trainee in hospital, training to become a GP. Behave like a GP. Think like a GP. Any case you see, begin to think, How would a GP address this issue? Failure of many to think like a GP is the reason why they get back to primary care. And the way they think, the way they manage their patient is still the way an hospital doctor will manage it. And that indeed is a leading cause of failure in the SCA. Don't be intimidated. You're not inferior to anyone. You only just made the choice to become a GP. Your friends in other specialty training will be telling you, how many C-sections they've done, how many knee replacements they've done. Congratulations to them. But those are not the skill sets you need. Focus on your own skill sets. Friends, when you do not know who you are, other people that don't know you will tell you who you should be. Those that know who they are will make exploits. Know who you are. Number 5 step is to start working on your portfolio. Do you have an area of interest that you've always loved that you would like to pursue? Now is the time to do so. Put yourself out there. Inform colleagues. Inform people that are doing what you have interest in doing. Say, for instance, you see yourself as a GP with specialist interest in dermatology. Now is the time you want to start organizing those dermatology clinics and attending them. I remember when I started my GP trainee and I had interest in medical education. One of the first things I did was to go to the medical education department of the hospital I was rotating in then to show my interest, to say, look, I'm interested in this. Are there any opportunities for me to be able to do this? And they gave me all the opportunities available. So now is the time to put yourself forward. Now is the time to let people know what you want. Now is the time to start laying that foundation of your portfolio. Number 6 step is to make friends. Don't try to do it alone. Make friends with people who are also GP trainees who are in hospital rotation. Form associations. If you've got the JDF in your trust, join the JDF. If there are issues that you're not happy about, take them to the JDF. Take them with your friends. They are more likely to receive a speedy response that way. Share burdens with your friend. Are there things that are not going well in your rotation? Let your friends know. That way, those that are coming are likely to know exactly what the challenges are and they know what it is they're going to be facing. Don't do it alone. And finally, number 7 step is shout for help. Are there things going on in that rotation that you feel a bit uneasy about? Are there things you feel you're not sure about? Ask questions. Escalate early. Speak with your clinical supervisor. If the case is not resolved, speak with your educational supervisor. If it is still not resolved, speak to your TPD. When we were told that only one of us should attend VTS and then come back to teach the remaining of us, we had to escalate to our linked TPD. We had to let her know, and within a couple of days, things changed. We were told to leave whatever we were doing to go attend VTS. And because of that, we were getting all we should be getting and we were getting the best out of our training. So escalate early. Friends, thank you so very much for watching my videos and for subscribing and for engaging. I appreciate your feedbacks. If you've enjoyed the video, please do well to subscribe so that you never miss any of my videos. Share with your friends, like and comment. Thank you so very much, and I will see you in the next video.